difficult for everyone. Parents are worried about the safety of their children. Small business owners and informal traders are losing much or all of their income. Workers are worried about their jobs and their income. The elderly and the frail need people to care for them. Some of those who live on the streets are without shelter or food. Students are missing their lessons in class and are worried about the future. All of us are experiencing great hardship and great anxiety at this time. This is to be understood. We have experienced a number of challenges that have imposed enormous burdens on our people. That is why we are taking various actions to support businesses in distress, assist workers whose jobs are threatened, and provide funding to small businesses. We are providing shelter to people who are homeless. We are continuing to deliver water to areas that do not have water so that our people can maintain high levels of hygiene. We are particularly concerned about the impact of the lockdown on the self-employed and on informal businesses. We are urgently developing additional measures to provide relief to them during this very difficult period. We know that there are many South Africans who are currently abroad and want to come home. We are paying attention to this and will be giving assistance where possible within our constrained resources. My fellow South Africans, we are now entering a new phase in the fight against the coronavirus pandemic. In the coming days, government will be rolling out a screening, testing, tracing, and medical management program on a huge scale. Around 10,000 field workers at the moment will be visiting homes in villages, in towns and cities to screen residents for the coronavirus symptoms. People with symptoms will be referred to local clinics or mobile clinics for testing. People who are infected with the coronavirus but who have no or moderate symptoms will remain in isolation at home or at a facility provided by government, and those with severe symptoms will be transferred to hospitals. Using mobile technology, an extensive tracing system will be rapidly deployed to trace those who have been in contact with confirmed coronavirus cases and to monitor the geographical location of new cases in real time. This drive is far-reaching, it is intensive, and it is unprecedented in scale. This grave health emergency is happening at a time when our economy is under great strain. As the country went into lockdown, we received the sad news that the rating agency Moody's had downgraded South Africa to a sub-investment grade. This will significantly increase the cost of borrowing to fund government spending and will have a negative impact on the economy. This development will not diminish in any way our response to the coronavirus pandemic. We are pushing ahead to implement the necessary health interventions and economic and social measures to contain the spread of the disease and alleviate its effects on our people. Within the constraints of the current crisis, we remain committed to implementing structural economic reforms to address weak economic growth, constrained public finances, and struggling state-owned enterprises. We're working together with our social partners to identify further measures we can take to limit the damage on our economy and to ensure that as we emerge